Now, many of us have some sort of private health insurance, and most people assume that their policy has them fully covered. A new survey, though, has found that more than half of the over 50s are still forking out a huge amount in gap payments.
That's right. Christopher Zinn from the 50 Up Club is here to talk us through it now. Hi, Christopher.
Yes, good morning. And this is the most painful part of private health insurance, apart from any procedures you might have.
Completely, because you think that you've paid your amount and that's the end of it.
That's kind of other insurances. Private health insurance, as we find, is so different from other kind of insurances. And look, the reason is there's so many moving parts. There's the doctors, there's the hospital, there's the x-rays, the tests, all of these things. There can be a gap between what Medicare pays and what your private health insurance fund pays. And that's the gap which you can be up to if you don't know and if you're not prepared.
So who's to blame for these gaps?
Well, look, the survey we did, 53% of people said they blamed the doctors and the specialists, and certainly that's a part of it because the doctors' amount isn't regulated, they can really charge. Having said that, the amount that they get paid by the government is frozen, that's gone down in time. Another bunch of people actually blame the hospitals and the funds, and then the hospitals lowest at 6%.
Fingers going in every direction.
There's a lot. It's a real dog's breakfast. It's very hard for people to understand, and I think that's why you need to focus on what you can do, not just complaining.
Well, what can you do? How can you avoid paying these gaps?
You can avoid paying them if you can have no gap cover with certain funds, and that's worth talking about.
And that's you pay a premium.
You may well do that. But the first thing is when you're going to have a procedure, ask the doctor or a specialist what the gap, to get an estimate of what the gap might be. Go to your fund, ask what they will cover, find that. You can negotiate with the doctor. That's a hard thing, but you can speak to their staff. There's a number of things you can do, but I think being forewarned is forearmed. Forearmed is being forewarned, rather, but really, if you know what's going to happen, do it in advance. Sometimes it's the day before people suddenly realise what they're going to be up to. It's too late then.
Huge bill shock.
Yeah, find out what, and you can then take steps to reduce the shock, if not the amount.
Yeah, for sure. How does the scoreboard look right now? How many people have signed up, and there's still time to join?
There is. We've got until Friday, at the end of the month. We're about 26,500, which is great. 25 was the target, but not the limit. There's really no limit, and it's the more people. You can go to 50upclub.com.au, no cost. .com.au, no cost, no obligation, just throwing your hat in the ring, and then we go to the funds and say, look, here's a bunch of people who are interested in getting a better offer in their health insurance. What can you do?
And you're confident that the power in numbers will actually deliver concrete results?
Well, look, these are all experiments. We're all tried, but yes, it's happened in the past. We believe that it can certainly happen now. Certainly that there is so much pressure around private health insurance, so much talk and policy reform. All that's great. But we can't wait for that. This is something we can do now. We're our own lobby group of consumers.
All power to you. That's great. Thank you so much, and hope we can get more people signed up. Thanks so much for coming in.
We'll wait and watch. And to join the campaign, all you need to do is go to 50upclub.com. There is no obligation to take up any offer, and the Nine Network is a commercial partner in that campaign.